Hello and welcome. My name is Dr. Shine Sabai, and in today's video, I'm going to show you how PCOS is properly diagnosed. I meet a lot of women every day that think they might have PCOS or their doctors have diagnosed them with PCOS, but they're just not sure how that diagnosis came about. So I want to clear all that confusion up and show you the 3-step process we use to diagnose PCOS more accurately. So most doctors will use the Rotterdam criteria to diagnose PCOS. And the Rotterdam criteria has 3 parts, 2 of which have to be met in order for PCOS to be diagnosed. The first of the criteria is to have irregular periods. This can mean a lot of things, including not having any cycles at all, having cycles that are longer than 35 days long, having cycles that are less than 21 days long, or having consistent bleeding that is not stopping. Anything that really goes outside of the 25 to 35 day cycles is outside of the norm and is considered irregular. The second criteria is having high androgens. Androgens are male sex hormones like testosterone or DHEA, which are also produced in women but at smaller amounts. When testosterone is high, women usually will experience symptoms like acne, unwanted hair growth, hair loss, and deepening of their voice. Also, they might notice that on their labs, their testosterone or their DHEA is high. The third criteria is visualizing cysts on the ovaries. Typically in PCOS, what the ultrasound will reveal is that there's more than 12 follicles growing on both ovaries. This gives a polycystic look to the ovaries, hence where the name polycystic ovarian syndrome comes from. So to summarize, there's 3 criteria: irregular periods, high testosterone, and cysts on the ovaries. Only 2 out of the 3 have to be met in order for PCOS to be diagnosed. So when your doctor says you have PCOS, the next question you should ask them is, what symptoms brought you to that conclusion? What criteria did I meet? Did I meet 2 out of the 3 criteria? If so, then they can comfortably diagnose you with PCOS. There are some women that only meet 1 out of the 3 criteria, but there's other symptoms to show, or their labs show, that it's starting to look a lot like PCOS. What I've seen in my practice is that there's a before PCOS type syndrome where this develops over time and then fully blown PCOS. But that's just my opinion, what I've seen in my clinical practice. Otherwise, it doesn't get more complicated than that. You just have to meet 2 out of the 3 in order to be diagnosed. Now that you know how PCOS is diagnosed, make sure to check out all my videos on PCOS, including the one where I talk about how to improve ovulation when you have PCOS. I'll see you guys in the next video.